Hi, my name is Bamet. I am a student SLP clinician, and today I want to talk to you about what swallowing is. And I know for most of us, or all of us actually, we think of swallowing as something so natural and so automatic that we don't really know how complex of a process it is. Swallowing is actually a more complex process that involves a sensory motor process, which involving precise coordination of more than 30 muscles and a several cranial nerves, such as cranial nerve 5, 7, 9, 10, and 12. Swallowing happens in four stages: the oral preparatory, oral transit, pharyngeal, and esophageal stages. Each phase involves a unique set of muscles, nerve, and bio mechanical action that ensure food and liquid are going through from our mouth to stomach in the right and safe way. The first stage we're looking at is the oral preparatory stage, and this is when the first step is the first step when we do put the food in our mouth, and that is mixed with the saliva, and it creates a cohesive bolus. And in this phase, there are muscles that are involved in chewing, which are the masseter muscle, the temporalis muscle, medial trigoid, um, as well as um, arbicuosis oris for lip closure and bicator for cheek tension and intriguing of the tongue muscle for the bolus manipulation. And within the same phase, the cranial nerves that are involved in this process, for example, are the trigeminal cranial nerve 5. This is for the jaw movement and facial sensation. Cranial number 7, which is facial nerve for lip and cheek control. And then now, once we create the bolus, we're moving into the oral transit stage. This is when the tongue pro propels the bolus toward the oropharynx. And in this stage, the muscle that are involved are the um, gen genioglossus and other intrinsic and extrinsic of the tongue muscles. And in the cranial nerves that are involved in this stage are the hypoglossal, which is cranial nerve 12, and this is responsible for tongue movement. In this stage, the biomechanic includes the tongue pressing in the bolus against the palate and pushing it to the posteriorly into the pharynx. And then now we're moving to the third stage, which is the pharyngeal stage. This is when the swallow becomes reflexive. Soft palate elevates to prevent nasal regurgitation. So the larynx elevate and the epiglottis fold down to protect the airway. So we're making sure that nothing is going through the wrong pipe. Um, in this stage, the muscles that are involved are the levator vel tunny for soft palate elevation, the myhyaloid, the geniohyaloid, and thyrohyaloid for larynx elevation, and pharyngeal constriction and bolus propulsion. propulsion. The cranial nerves that are involved in this are cranial nerve um, 9, which is the glossopharyngeal, which provides the sensation and helps trigger the swallow. The vagus nerve, cranial number 10, which controls the laryngeal closure, pharyngeal constriction, and opens the upper esophageal sphincter. And the last one would be cranial nerve 11, accessory. This assists the soft palate and the neck stability. Um, Biomechanically, this includes the tongue base retraction and the pharyngeal stepping wave and hyolaryngeal extraction, which works together to close the airway and open the upper esophageal sphincter. And then going to the last phase, which is the esophageal stage. This is when the bolus move from the pharynx to the stomach. Esophageal uh, is coordinated by the vagus nerve 10, cranial nerve 10, and involves the series of smooth muscle constriction that pushes the bolus downward. This is this stage is fully voluntary and cannot be impacted by like mobility disorder or nerve damage. If any of the stage is disrupted, swallowing difficulty can occur, and one of the major concerns is slight aspiration, and that's where food or liquid enters the airway without triggering any type of cough. This is why we use the instrument evaluation, such as the FEES and the VFSS, as well as the clinical screening like the Yale 3-ounce water test to assist swallowing safely and guide treatment. And understanding how normal swallowing works help all of us on the care team recognize potential issue and support safe and effective management strategy for our patients. Thank you for listening.
Hi, I'm Carolyn, the SLP student clinician, and I'll be talking to you today about what happens when you swallow and why it's so important. So, swallowing happens in 4 quick, easy steps, but there's a lot that goes behind the scenes. So, first, when you eat or drink, your lips and cheeks help keep the food in your mouth while your teeth and jaws chew. Your tongue moves everything around and mixes it with saliva until it's easier to swallow. Next, your tongue gently pushes the food to the back of your mouth, kind of like rolling a ball down a slide. And this tells your throat that it's time to swallow. Then your throat muscles get to work. A small flap called the epiglottis closes off your airway so the food doesn't go down the wrong pipe. At the same time, your voice box lifts up and the muscles in your throat squeeze to push the food down the right tube. Finally, the food enters your esophagus. That is the tube that leads to your stomach. The muscles in that tube gently push the food down until it gets to your belly. So all of this happens in just a few seconds, but if any part doesn't function properly, the food or drinks can go into your airway. So this is called aspiration, and this happens often, especially if you don't feel it, and this can lead to cough or even pneumonia. So that's why we're checking your swallow today, just to make sure everything's moving the way it should. Thank you.